Hey, it's Dr. Troy from Vancouver Disc Center. I'm with Randy here, and Randy's from Vancouver. Randy, can you tell people what you had going on before you came to see us?
Yeah, about 2 years ago I got hit with sciatica, extremely painful, and I was in bed for 4 solid weeks. Never experienced anything like that before, didn't know what it was. A friend of mine who was a chiropractor who knew of Dr. Troy came and visited me, a really good friend, and we got to talking. I came over to Dr. Troy's clinic and he walked me through what was going to happen with the treatment, what kind of treatment was required for sciatica. I only lasted for 4 sessions. The pain was just too much. I decided to go ahead with surgery. And
They did discectomy?
they did the discectomy and recovered from that. Did not do any more sessions with spinal decompression. And that lasted 2 years. And then just recently, about 2 months ago, I got hit with sciatica again. This time, knowing what was happening to me, I ran over immediately to Dr. Troy and began sessions of spinal decompression, physical therapy,
Cold laser.
And caught it in time. I'm not going back with surgery. That was very painful, lasted 2 years, which is not a winner in my book. And so I'm into my second session now, or rather, when a block of 12 sessions, I'm into my second block, and
It's been about 5 weeks.
About 5 weeks, and definitely see a recovery. I see.
And what have you noticed?
So the sciatica left about 2-3 weeks ago, 4 weeks ago, and hasn't returned. The sciatica, the actual pain, the neuropathy has stepped way back and is now transferred a little bit to the left leg. That was in my right leg. I hear that's normal, that sometimes in the recovery phase we'll kind of go back and forth. I'm able to stand in my studio and paint again for a couple of hours at a time with no neuropathy. Sciatica again is gone totally. And so now I'm just dealing with a little bit of back pain from the decompression as my spine gets readjusted, and the neuropathy is receding, so I'm looking forward to a normal life again.
Yeah.
And in fact, pretty much have that at this moment.
Yeah, getting back
so
on track.
It definitely works.
And then what would you tell somebody who's on the fence and thinking about spinal decompression, or maybe their doctor said, oh, I don't know, they don't have answers, they want to do surgery or injections? What would you tell somebody who's
Well, I think
on the fence?
one thing that's really important is get a second opinion. And it doesn't hurt, it's not painful. Come over to Dr. Troy's clinic and let him run you through what you've been told, check out your MRI, and what the possibilities are. One thing I will say that I think is important is this is a man who I've never seen invest so much into training himself more. He's out, sometimes I'd like to have him treat me, and he's not here because he's at a conference learning more about how to treat people.
Yeah.
But definitely get a second opinion.
Good. Excellent. Thanks, Randy. Glad for your results.
Absolutely.
Amazing.
I'm glad for my results, and I hope you get them too.
All right. Thank you.
Thanks.